Hello, Dr. Pickett. I just want to ask, what is your opinion on prescriptive authority of psychologists?
Okay. Um, well, I would say that my general opinion about prescriptive authority is that I think that psychiatrists should be, that should be a task that's left up to psychiatrists. I think, the specialty that psychiatrists sort of bring to the table with regard to medication is probably very important. And then I think that sort of allows the two fields to sort of work together. So psychologists having their expertise in psychotherapy processes, assessment, and then psychiatrists having their expertise in like biological components of mental illness. So I think working together in that way is probably best. But I would say that there are some states that allow prescriptive authority, and I think that in some cases that allowing psychologists to have prescriptive authority does increase access to appropriate mental health care. So I think in some cases or in some states or in some rural areas where allowing prescriptive authority actually increases access to care, I think that should be taken into consideration as well.
Okay, thank you. And also, in your experience working by yourself with psychotherapy versus working with a psychiatrist, do you think that working with a psychiatrist, with you giving psychotherapy and the psychiatrist giving medication, versus you being able to give medication and psychotherapy, which one do you think is more effective?
Okay. So I would say that in my practice, if I had prescriptive authority, I think that I would probably use it most in cases in which we were removing patients from medication, so what we call like down titration. So I'd would like prescriptive authority in cases in which we're removing patients from medication as they are beginning to use some of their psychotherapy skills. And having a psychiatrist involved in that process doesn't seem very necessary, so that might be one case where, for me, I think that would be where I would like to maybe have that authority. Or just switching between medications that are basically the same but may work slightly different depending on the patient. So that might be another case. But other than that, I wouldn't really see myself prescribing new medications to patients, or sort of taking on in my practice that would be sort of a primary role that I would like in my practice. And that's because I have really seen the benefit of a psychologist and a psychiatrist working together in tandem to treat patients. And I actually think that's really the best method. So I think both practitioners have expertise, psychologists' expertise in like psychological processes, behavioral processes, and then the psychiatrist having expertise in like the biological contributions. So I think that bringing those two together, so the psychotherapy processes and the medical or the medication treatments together, are really the best approach. It also gives sort of two unique perspectives. It also allows people not to work in isolation. So I think having two professionals working with an individual on one problem or a series of problems can actually just improve the treatment, and that's really been my experience. So that's kind of another reason why I think that my opinion is that they should be separate, which goes back to your other question, but because I have seen that it is really beneficial, or can be really beneficial, to have both perspectives.
Okay.